Welcome back, anatomy students. This is the second part for the respiratory system. If you recall, we left off, we learned a little bit about the nose, the mouth, the throat, and I think we left off at the larynx. Then we're getting into the next part that air goes through as we breathe, and that is the trachea. This is also known as the windpipe, more commonly known that. If you're thinking about where the trachea is, it's stationed in front of or anterior to the esophagus. Okay, so the esophagus goes down the backside of the trachea. The trachea is pretty unique in that it's always open. It's always open. Of course, the epiglottis closes it up when we swallow, but this is always open. The esophagus, we would think, oh, it's always open too. Actually, it kind of flattens in on itself. It's very, flexible. The trachea, however, is held open by these C-shaped rings of cartilage. Okay, you can kind of see those here. Of course, this is a cross section cut open here. But these little rings almost looks like backbones here. It's a good diagram to see that. Cartilage is what makes up those rings. Remember, we learned a little bit about cartilage months ago. It's not as rigid as bone, but it does hold its shape. This is hyaline cartilage. Lining the trachea is cilia. Remember those hair-like protrusions that we see in the nasal passages, and also mucus. Mucus is all up through here. And why do we have those? To protect the lungs. So if some kind of particles, got through our nasal passages and even got through our pharynx, larynx area, we're still trying to protect those lungs. They are very, very sensitive. So even the trachea is set up to do that with the cilia and the mucous membranes. Excuse me. Down at the bottom of the trachea, we'll see the bronchi. It splits into a left and right side. So the trachea, windpipe. Now we say it's flexible here because think about if you were to bend side to side, front to back, all that kind of stuff. The trachea needs to be able to bend. So that's why these rings are so important. And they're not just a solid structure. It gives that bending capability. I'm having to clear my bronchi, trachea. Next up is the bronchial tree, and this is kind of the umbrella term we give for all the next couple things. It's simply because if you looked at this structure, if you stood on your head right now or flip your Chromebook upside down, you'll say, hey, it looks kind of like a tree. It's got a trunk, then it goes out into these large branches, which then branch off into these smaller branches, and then eventually we got little tiny branches at the very end. So just your generic tree there. We call this the bronchial tree. It's a passageway from the trachea or the windpipe down to the alveoli, and we'll learn more about those in a minute. And here it includes the bronchi, the bronchioles, and the alveoli. We're going to look at those a little more in depth. So the bronchi are these two principal tubes that extend from the trachea into the lungs. We'll see the setup here in a minute, but the lungs, imagine being right here. So the lungs encapsulate the bronchi, both of them. And then all the bronchioles and the smaller stuff. Does not contain the windpipe. It's on the outside. We'll see a picture here in a little bit. We have two principal bronchi or bronchus, if we're talking about a singular one. And these branch straight off going into our two lungs from the windpipe. So bronchioles are the smaller tubes that branch off from the bronchi. So it's kind of got a arteriole situation here going on. We got the bronchi and then the bronchiole, smaller tubes that branch off. Then we have the alveoli, and the alveoli is a very unique structure. It's almost like little berries hanging on the end of the alveoli. They're these sacs, though. These little air sacs, and this is where gas exchange happens. This is where I believe the video that you saw for introduction talked about this a little more in depth, where oxygen is dropped off because there's a very thin membrane between these, alveoli and your blood vessels, the capillaries that come in here. So oxygen is able to move out into the blood, and carbon dioxide is able to move into the alveoli, which then will return out through all the structures and breathe out. So this is where gas exchange happens, though. These are super important. If our alveoli, and we'll talk about some diseases where the alveoli are damaged or not as efficient as they should be, can definitely damage your breathing, but not only that, the oxygen level in your blood and throughout your body. So we need that oxygen for cellular respiration. We need to get rid of that carbon dioxide, which is a waste product of cellular respiration in every one of our cells in our body. So the alveoli is a super important player, and not only in the respiratory system, but the cardiovascular system. So these are some pictures of lungs. Many of us probably have never seen an actual pair of lungs. These are them. You can see a little black markings here. That doesn't mean necessarily damage. We'll look at some damaged lungs later on. That's just normal breathing. As we breathe in contaminants. Like I said, lungs are very sensitive. Our body's set up to do a good job keeping out contaminants and particles and all that, but some get through, and our lungs can become a little discolored because of the ones that do get through. As you can see, this is just normal wear and tear. Imagine doing things like smoking or vaping or anything like that, or living in a polluted environment, working in a polluted environment. This is lung opened up. A lot of people have the misconception that the lungs are just hollow like balloons. They are certainly not. Here's all the bronchioles coming through, and you can kind of see how it looks like a tree, this bronchial tree coming in, and you can even make out some of these small little tiny things on the end, the alveoli. Here's a good little section right there, all these little dots. So anyway, this is not a hollow organ. It is a full organ, but it's elastic, as we're going to see here in a minute. And there's just a really good picture of your trachea, and then how these would go into the other lung sitting here. Of course, this is really normal damage. It's probably somebody that's later on in life. Of course, now they're dead, but later on in life is when they expired. So they had a lot of lung damage, but not extreme. But you can really see the tree here, how we come out in this main principal bronchus, and then it branches out. All right, so let's talk about the lungs. The lungs, protected by the thorax, your ribs, your sternum, they do a really good job allowing some flexibility. You can get a deep breath and you can feel those things expand out, but they also give that hard, rigid structure that protects the lungs and also the heart. Elastic tissue is what makes up the lungs, and that's super important for inflating and deflating without losing any shape. Think about it. You can breathe out all your air. Your lungs don't shrivel up like a balloon does. Okay, they go back to a normal shape. Now, as you inhale, they do get bigger because they're elastic, but they always return to their shape unless there's something wrong with them. Surrounding the lungs, just right on top of it, is the pleura. The pleura, there's two different parts, the parietal and the visceral, and this is an outermost layer and an innermost layer. This is a great diagram to look at that. Serous fluid, we've seen this several other places, is found inside that cavity that makes up between the two pleura. And all it does is reduce friction when you breathe. Think about when these lungs expand. If they expand a whole lot and there's nothing around them to kind of give them slickness, a reduction in friction, then they might rub on the ribs or other soft tissues that surround there. So that just kind of gives them an extra layer of protection. Very, very sensitive, not only to particles coming into it, but also to the environment around it. So that's why the pleura is so, important. In looking at the lungs, the right and left lung are different. So your right and left lung are different. Of course, that's the model's view. We're looking at it right here. This would be if the model's looking at us, of course, their right and left lungs. The right lung is much larger than the left. Well, I say much, but a good size. The right lung is also divided into 3 lobes, as we call it, instead of 2, which is found in the left lung. And the reason for the difference is because the left lung gives room for the heart. It's called the cardiac notch. Our heart actually sits right in there in between our lungs. They're very closely, not only in distance, but in their function. Remember how the heart and the cardiovascular and the respiratory system are so closely linked. But the heart sits right there. Remember we talked about the heart. It's kind of in the center part of your chest, but it has a leftward lean, a leftward kind of diagonal lean, and that's where it sits, right there. Of course, think about the pleura. These lungs also need to be protected from friction with the heart, and the heart also has that layer of protection around it. So a lot of things moving and shaking, rubbing against each other, but our body does its best to keep everything protected with little bitty things that we oftentimes overlook. So right lung is much bigger. One more lobe, left lung smaller because of the cardiac notch. And that brings us to the end of part 2. I believe there's a quiz following this. You feel free to use this video to fill in your notes as always, and then also to take your quiz.